Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. How do you inject Repatha? How do you inject Repatha prefilled syringe, Repatha SureClick Autoinjector, and the Pushtronex system, Repatha Onbody infusor, for Repatha? What is Repatha? Repatha is a subcutaneous injection, an injection that goes under the skin, used to reduce low-density lipoprotein cholesterol in specific patients. Repatha comes in 3 different forms: Repatha prefilled syringe, Repatha SureClick Autoinjector, and the Pushtronex system for Repatha, Repatha Onbody infusor. Where on your body do you inject Repatha? All forms of Repatha can be injected into front of your thighs, the lower part of the abdomen except for the area least 2 inches around your belly button, the outer area of the upper arm, if someone else is giving you administering it. Important information about Repatha injections. You should only inject into clear, healthy skin. Do not inject into any areas that are bruised, tender, red, or hard. Do not inject Repatha into the same spot each time, move to a different spot for each injection. You should only administer Repatha if you have been trained to do so by a healthcare provider. All forms of Repatha should be stored in refrigerator 36F to 46F, 2C to 8C. You should only administer Repatha if you have been trained to do so by a healthcare provider. How do you use the Repatha SureClick Autoinjector? Step 1. Prepare for the injection of Repatha SureClick Autoinjector. Take the Repatha SureClick Autoinjector out of the refrigerator 30 minutes before administration. Get everything you need ready: your Repatha SureClick Autoinjector, alcohol wipe, cotton ball and sharps disposal container. Wash your hands before you start, then clean the injection site with an alcohol wipe and let the area dry. Check the expiration date and check the solution is clear and colorless to slightly yellow. Step 2. Injection of Repatha SureClick Autoinjector. When you are ready to inject, remove the orange cap. The cap should only off the device a maximum of 5 minutes as the medicine can dry out. At the selected skin injection side with thumb and fingers about 2 inches apart, pinch the skin to form a firm surface, or instead stretch the skin between thumb and fingers to form a firm area of skin about 2 inches wide. Holding the autoinjector in a fist grip with your thumb towards the top end, press the yellow safety guard end of the device firmly against the skin, holding the autoinjector 90 degrees to the skin surface. Continue holding the autoinjector firmly against your skin, and when ready to inject, press the gray button all the way down. You will hear a click. Continue holding the injector firmly against the skin until the window goes from clear to yellow. This could be at least 15 seconds, then the injection will be finished. Step 3. Finish. When injection is complete, lift the autoinjector straight up, and discard the autoinjector into your sharps container. Check the injection site. If there is any bleeding, apply pressure with a cotton ball and then apply an adhesive bandage if needed. How do you use the Repatha Pushtronex Repatha Onbody infusor? Step 1. Prepare for injection of Repatha Onbody infusor. Take the Repatha Onbody infusor out of the refrigerator 45 minutes before administration. Get everything you need ready: your Repatha Onbody infusor, alcohol wipe, cotton ball and sharps disposal container. Open the carton and firstly remove white paper cover, then remove the plastic cover from the clear tray. Leave the Onbody infusor in the clear tray until you are ready to inject. Clean the injection site with alcohol wipe. The injection site needs to be firm, flat and relatively hair-free. Step 2. Set up the Repatha Onbody infusor. Take the Onbody infusor out of the carton and open the cartridge compartment by swinging the cartridge door to the right. Pick up the cartridge and check the expiration date and check the solution is clear and colorless to slightly yellow. Holding the cartridge barrel, clean the cartridge bottom with an alcohol wipe. Place the cartridge into the cartridge compartment of the Onbody infusor and press it downwards until it is secure. Once the cartridge is in place, it should be administered within 5 minutes or the medicine can dry out. Swing the cartridge door to the left until it snaps closed. Step 3. Apply Repatha Onbody infusor for injection. Peel and remove both green tabs. This will expose the skin adhesive and will turn the on-body infusor on. It will start beeping and a blue light should be flashing when it is ready to be applied. Apply the on-body infuser to the selected cleaned skin area, avoiding any skin folds or bulges. Make sure it is firmly attached. Once it is firmly attached, you can push the start button, which will use the green light to flash, and a click will indicate the injection has started. It will take approximately 5 minutes to complete infusion, and then the green light will stop flashing and become solid green light. You will hear several beeps and the plunger will fill the medicine window all the way. Step 4, Finish. When the infusion is complete, you can grab the edge of the skin adhesive and gently peel the on-body infuser away from the skin. If the plunger does not fill the window, it is important to contact your healthcare provider. Discard used Repatha on-body infuser into your sharps container. For more information on how to administer Repatha on-body infuser with diagrams, see Repatha patient counseling information. Related questions: Are there any dangers of taking Repatha? Praluent versus Repatha, what's the difference? What is the difference between CYou and Repatha? How do you use the Repatha single-use Repatha prefilled syringe? Step 1, Prepare for injection of Repatha single-use syringe. Get everything you need ready: your Repatha single-use prefilled syringe, alcohol wipe, cotton ball and sharps disposal container. Wash your hands before you start, then clean the injection site with an alcohol wipe and let the area dry. Carefully remove prefilled syringe from tray, then check the expiration date and check the solution is clear and colorless to slightly yellow. Step 2, Injection of Repatha single-use syringe. Carefully remove the gray needle cap of the syringe and discard gray needle cap. At the clean injection site, pinch the skin between thumb and finger to form a firm surface that is about 2 inches wide. Insert the needle into the firm skin at an angle between 90 and 45 degrees. Push the plunger all the way down using slow and constant pressure, so that the syringe is empty. Step 3, Removal. Once injection is completed, release your thumb from the plunger and gently remove the syringe from the skin. Discard the used syringe into your sharps container. Check the injection site. If there is any bleeding, apply pressure with a cotton ball and then apply an adhesive bandage if needed. For more information, including diagrams on how to administer Repatha prefilled syringe, Repatha SureClick Autoinjector, and Repatha Onbody infusor, see Repatha patient counseling information. How often do you inject Repatha injections? Dosage of Repatha is dependent on which type of hyperlipidemia you are treating. Prevention of cardiovascular events and primary hyperlipidemia. Dose is 140 mg every 2 weeks or 420 mg monthly. In patients aged 10 years and older with heterozygous familial hypercholesterolemia, HFH. Dose is 140 mg every 2 weeks or 420 mg monthly. In patients aged 10 years and older with homozygous familial hypercholesterolemia, HFH, 420 mg monthly. The dosage can be increased to 420 mg every 2 weeks if a clinically meaningful response is not achieved in 12 weeks. Patients on lipid apheresis may initiate treatment with 420 mg every 2 weeks to correspond with their apheresis schedule. Administer Repatha after the apheresis session is complete. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.